So Manisha, Anant, and Anil all were part of our original group of 9 who were together from 1991 to start the Anusandhan Trust. When, as is our policy, that we should not occupy the place all the time. We should make space for the younger people to come and take over. And I think this is one of the major weakness of most of the NGOs, that those who start, they never go. So this is a new trend where, we ensure that our institutions are headed by people and the directors keep changing, so that it is a public place. It is like any public institution that you have, rather than anybody's private institutions. So as our trustees started stepping down, we had one trustee who joined but then had to leave the trust because of demand of her own work. That was Professor Lakshmi Lingam. I'm sure most of you know, from Tata Institute of Social Sciences. She joined us in 2005, and then because TISS was being reorganized and the Hyderabad campus was being set up, and she had a lot of workload, so she had to step down. So she has not been able to come today, but we will definitely send her a memento and our wishes from the meeting to her. So this is a honoring of our past trustees, and I hope in coming meeting, whenever these trustees step down, we will be having the similar kind of things organized. And I think that's a good tradition. The more and more should step down and new ones should take over, so that there is more dynamism in the institutions that we are building. So may I now request Dr. Abhay Shukla to take over and start the proceedings of the meeting. Dr. Abhay Shukla.
Thank you, Amar. And I would now like to invite our speakers and discussants to the dais so that we can start the proceedings. So first of all, I'd like to invite our international guest, Dr. Armando De Negri, to come to the dais. Armando. And I'd request Neha to felicitate Dr. Armando. Armando is from Brazil, as you probably know, and he will be sharing with us a lot of experiences from the other part of the globe. Please take your seat. Next, I would like to invite Dr. Srinath Reddy to please come to the dais. And Neha, could you please felicitate Dr. Srinath Reddy? Dr. Srinath Reddy, again, I will be introducing him in detail, but most of you know about him, and he probably doesn't need much detailed introduction. Dr. Srinath Reddy. Next, I'd like to invite one of our discussants, Renu Khanna, to please come to the dais. Many of us working in the social sector and in the health sector know Renu, and welcome, Renu. Neha. And finally, I'd like to invite our next discussant, Mr. Gautam Modi, who is the National Secretary of the New Trade Union Initiative, a trade unionist, social activist, and also a person deeply interested in health, and one of our discussants for today. So, friends, colleagues, and speakers and discussants, a very warm welcome to all of you for today's Krishna Raj Memorial lecture, or rather event. And the theme for today is moving towards a system for universal access to healthcare in India. We have, as Amar described in our previous events, we have had one lecturer. Today we have a double dose from 2 doctors. And 2 physicians and public health activists will be sharing their ideas with us. But I think you'll agree that given the size and complexity of the problem, we need a double dose. To reach universal access to healthcare in India, we do need inputs from a very wide range of sources. And so therefore we'll today have both the international dimension and the national dimension of how to address this complex and very important theme. Uh, I don't think I need to reiterate to you about the need for a system for universal access to healthcare in India. The fact that how access to quality health services today is a serious problem, not only for the rural poor, not only for the urban poor, but also for the middle class, where there are a whole range of problems of accessibility, of rationality of care, of quality of care, and of course, of appropriateness of the kind of healthcare that we are getting right now. And as we all know, we have a mixed health system which is highly privatized. And in a sense, we have the worst of both worlds. So we have some of the worst features of a private healthcare system. And we also have some of the negative features of a poorly managed and underfunded public health system. And this is the kind of situation from which we need to move forward towards a system for universal access. And basically the challenge is, how do we move towards a situation where, along with strengthening of the public health system, strengthening and expansion of public health services in both urban and rural areas, we also manage to regulate the private sector, which is today a very large and unregulated sector, and how both of these providers, public providers as well as private providers, are brought under a common, publicly managed and publicly funded system which will provide good quality health care to all Indians free of cost. This is the challenge. And this is not an unrealistic dream that we are talking about. This is actually a kind of system which we can see has been achieved in many countries of the world, both in the developed world and also, of course, in some developing countries. And internationally, of course, with the notable exception of the United States, most developed countries do have some kind of system for universal access to healthcare. And today, in the United States, as you know, there's a major debate, policy debate going on about how to move towards a universal access system. But not only countries with high incomes, but even developed countries like Brazil and Thailand have achieved systems for universal access to healthcare. And in fact, it is important to note, and that is the reason why we have invited Armando, that how a very large, diverse, and complex country like Brazil, which has very massive income inequities, yet, despite all of these challenges, it has managed to achieve a system for universal access to healthcare where every citizen can get basic health services free of cost of a reasonably good quality. So we felt that to actually talk about the system in Brazil and to share these experiences, Armando, whom I will be introducing shortly, would be probably the best person to tell us about how this has been achieved in another country, which has lessons for the Indian situation. So today what we see is that actually both internationally and nationally, universal health coverage and universal health care are emerging on the agenda. And that is one reason for why we chose this theme for this particular Krishna Raj Memorial event. So internationally, as I said, that there have been processes of moving towards universal healthcare which have culminated in recently certain major international events, conferences, and other processes where the theme of universal health coverage is now being very strongly discussed and debated, of course, from different perspectives. And one of the countries which has been in the lead of actually taking up these discussions and debates is Brazil. And just last month, there was a major international conference in Brazil where the entire theme of universal access to healthcare and social security was discussed. And therefore, that is the international context. But there is also a national context. And the national context is that, as you probably know, recently the Prime Minister's office and the Planning Commission have set up a high-level expert group on universal health coverage, which is deliberating on, discussing, and working out the broad contours of what such a system would be in the Indian situation. Given all the complexities and diversities, our large, unregulated private sector, all the problems in our public health system, in rural areas, in urban areas, how would we move towards a universal health coverage system?